Welcome to Wednesday's edition of COVID-19. There has been a rebound in cases here in Korea amid cluster infections involving several missionary schools run by the same religious organization. Accordingly, authorities that is, are working to stem the latest spread as well as the potential spread of variants here in the country. First up, I have our Konsua with the broader pandemic update. Korea, that is. Let's begin here in the country where we have over 500 cases today.
Right, Sunny. We are seeing a surge by over 200 new cases compared to yesterday. 559 infections were reported this Wednesday. Domestic transmissions have also risen to the low 500s, and we're also seeing the highest number of imported cases in 18 days. Now that raises the total number of cases to 76,429. The death toll stands at 1,378, with a single-digit rise in daily deaths. Recently, we have been seeing double-digit figures in the past days and weeks. Now, it is the first time in 10 days that the number of daily cases has surged to the 500s. As you can see on our graph, in the past week, the numbers were hovering in the 300s and 400s. Now, Wednesday's figure has raised the number of average domestic cases on a daily basis in the past 7 days to 389.
Right. Now, so the outbreak at a missionary school that we spoke about earlier in the week is leading to a mass cluster infection.
Right, Sunny. If we first check Wednesday's numbers by region, we see here in Gwangju 112 infections. And with that, this part of the country has a triple-digit figure along with Seoul and Gyeonggi-do province. Now, this is because 109 cases were confirmed at the TCS ACE International School in Gwangju, which is run by the IM Missionary Society, which also operates the IEM school in Daejeon, which is the origin of this recent outbreak. It was found that these dormitory-type institutions have not properly abided by prevention rules, so the government is taking a firm stance to stop further spreads.
The government has modified its prevention guidelines for unaccredited religious schools to close the loopholes and has informed local governments of the changes.
And that includes a suspension of dorms unless students submit a COVID-19 test result before moving in and practice strict social distancing measures, such as no eating outside of designated dining areas. The government has so far conducted on-site inspections of 40 facilities related to the IM Society that are spread out across the nation, resulting in a total of 297 infections at 6 locations. And now let's shift over to the international front. We are seeing a concerning rise in fatalities with over 17,500 new deaths in the span of 24 hours as of noon Korea time. And meanwhile, the UK has accumulated 100,000 fatalities, becoming the first European country to hit that milestone. And with that, let's take a look at the 5 countries with the highest number of fatalities here in order. The U.S. over 435,000 deaths so far, followed by Brazil, India, Mexico, and again the UK now at 100,162. And this is pretty much similar to the order of infections. If we take a look at this table, as the UK has the 5th highest number of infections around the world, but a concern, especially when it comes to fatalities, Mexico, as we saw earlier, has the 4th highest number of fatalities, but here the 13th highest number of total infections. In the meantime, Indonesia has become the next country to surpass 1 million cases in total. And those are the updates I have for now. I'll be back with more tomorrow. Sunny?
All right, so thank you. See you tomorrow. Meanwhile, for more on COVID-19 related news here on the local front, I have our Kim Hanul in the studio. Welcome, Hanul.
Good afternoon.
Right, let's begin with the latest government plans for the upcoming school year.
Right, so the new school year begins in March in Korea, and unlike last year when the first day of school was postponed to April, this year schools will start on time, whether it's online or offline. However, the government plans to offer more in-person classes this year, especially for younger students. Take a listen.
We will work closely with the Office of Education to prioritize the resumption of preschool, lower elementary school, and special ed classes as they tend to benefit more from face-to-face learning and require additional needs.
The Education Ministry is planning to dispatch an additional 2,000 temporary teaching staff to around 2,300 lower elementary classrooms, where the student-teacher ratio is over 30:1. This is aimed at reducing the size of classrooms and allowing a safer in-person learning environment to prevent cluster infections. The ministry believes that younger students have a steeper learning curve when it comes to using remote learning technology, and important academic foundations are built at this age, so face-to-face learning is essential. The ministry is also planning to open after-school learning centers nationwide to help students shake off the rust from spending months taking online classes. As for remote learning, the Education Ministry plans to improve the quality of online curriculums by offering more two-way distance learning programs and setting up 5G networks at around 250,000 public school classrooms. The ministry plans to unveil more detailed plans regarding the upcoming school year this Thursday.
Right. Meanwhile, Hannah, one final question before you go. What's the latest with regard to the financial support for the self-employed?
Right, so over 3.6 trillion won, or roughly $3.2 billion have been handed out over the past 2 weeks as part of the government's third round of emergency cash handouts here in the country. The relief package is aimed at supporting small businesses that to have suffered from shutdowns and social distancing rules, with the level of compensation being determined by the severity of the restrictions that each business was subject to. Businesses that were forced to shut their doors entirely are eligible to receive 3 million won, including 1 million won in rent subsidy for the month of January. Small business operating under restrictions were given up to 2 million won, and even regular businesses can receive up to 1 million won. Starting today, the government will also offer more financial aid to businesses that have already received 1 or 2 million won, but were later forced to shut down due to year-end restrictions, which affected winter sporting venues, among others.
Right, hopefully that aid will offer them some form of short-term relief. Hannah, as always, thank you for that coverage.
Thanks for having me.
Right, along with the temporary screening centres set up nationwide to allow for greater and quicker testing, Seoul city officials also have a mobile unit that makes its way to different parts of the city, much to the comfort and convenience of those seeking COVID-19 testings. To take a look.
대전의 대한학교에서 125명의 대규모 확진자가 발생해 참으로 안타까운 마음입니다. 또한 이번 기회에 유사한 대안학교 기숙시설에 대한 일제 점검과 필요한 방역 대책을 신속히 마련해 주시기 바랍니다.
Hi, this is Jessica Lee. With continuous concerns of COVID-19 cluster infections, such as at nursing hospitals, the Dongbu Detention Center, or a taxi company, the Seoul Metropolitan Government is operating one-day more approachable COVID-19 screening centers at places found to be highly vulnerable to the virus. So today, let's take a look at an area where this kind of temporary COVID-19 screening center is installed to see how these makeshifts are working exactly. At these pop-up COVID-19 test sites, more than 5,000 tests were carried out preemptively from the 23rd of last month.
거동이 불편하신 분이나 아니면 이렇게 생업에 종사해서 바쁘신 분들을 위해 찾아가는 선별 진료소를 운영하고 있습니다. 기관 인근 공터나 아니면 이제 주변에 이제 이동하기 편한 곳에서 이제 선별 진료소를 운영하고 있습니다.
Before the COVID-19 outbreak, Namdaemun Market was also a famous attraction for many foreign visitors, but now it's relatively quiet. Moreover, as recently, a cluster infection has occurred right here at the market. Merchants are on high alert.
이제 장사하시면서 조금 어려운 점, 불안한 점이 당연히 있으시겠죠?
그렇죠. 남대문에 그 감염자가 있어갖고 그거로 인해서 손님들이 더 많이 안 찾아주고 또 서로 피해하는 그런 상황들이에요. 서로 말을 할 때 서로 안 마주치고 약간 저 자신도 마찬가지로 약간 옆으로 삐껴서 말을 하고 그렇게 대화하면서 장사하고.
To stem the spread of further COVID-19 cluster infections, the Seoul Metropolitan Government is operating this special one-day COVID-19 temporary testing center. Today, it's raining a little bit. However, the center is still in operation. So what are the differences between this one-day, more approachable COVID-19 temporary screening center and other screening centers?
감염이 막 곳곳에 숨어 있거든요. 숨어 있는 곳에 적시에 먼저 찾아가서 선제적으로 대응한다는 점에서는 되게 의미가 커요. 선뜻 나서서 오시기 어려운 분들 먼저 찾아가서 해서 거기서 실제로 뭔가가 나왔다, 아프리카가 나왔다고 보고를 받았을 때 그때가 좀 보람이 있었다는 생각이 듭니다.
Through this more approachable COVID-19 test center, a total of 6 cases were identified at various testing sites, such as in logistics centers.
이런 찾아오는 선별 진료소를 통해서 무증상자들을 발견하게 되고 그 무증상자 발견이 집단 감염을 예방할 수 있기 때문에 저희들에게는 좀 보람된 부분이기도 하죠.
This one-day, more approachable COVID-19 temporary screening center is working in the same way as other COVID-19 screening centers. Once you enter, you need to turn in the information and then follow the guidance of healthcare workers to get tested for the virus. The test is being carried out as fast as possible, and this is also a big help for busy merchants as well.
저희도 좀 불안하죠. 근데 이번에 진료소가 이제 생기고 나니까 좀 편안하게 저희가 진료받을 수 있어요. 좋아요.
What is the operation plan for this one-day screening center from here on?
아무래도 이제 코로나 검사가 어려운 분들이나 혹은 이제 감염이 되었을 때 파급력이 높은 분들 대상으로 지금 조사를 받고 있는데요. 우선 지금 다음 주까지 영등포구나 은평구 같은 노숙인 지원 시설이 있습니다. 노숙인 지원 시설의 이용자랑 그리고 그 이제 직원들 1,000명 정도를 검사할 예정입니다.
Thanks to healthcare workers who are working in tough schedules and in cold weather without losing smiles on their face, we're able to get tested for the virus in a much safer and easier way. To help them fighting against the virus and stem the further spread of the virus and go back to our normal daily lives, we all should follow personal hygiene guidelines as well. This has been Jessica Lee.
In addition to spreading more quickly, the new variant may be associated with a higher degree of mortality.
코로나19의 도전은 더욱 거세지고 있고 심지어 무서워지고 있습니다. 변이가 등장한 것이 그 핵심이라고 말씀드립니다. (3개월이) 지난 시점에서는 탈모와 운동 시 숨이 찬 증상이 6개월이 지난 시점에서는 피로감이 상대적으로 높게 나타나는 경향을 보였습니다.
The global tally of COVID-19 cases has topped 100 million, while the death toll has reached above 2 million. Now, against this grim backdrop, authorities worldwide are tackling coronavirus variants, while survivors are battling the long-term effects of COVID-19. For more on this reality, I have Dr. Alice Hyungyong Tan from Miss Mary Women's Hospital. Welcome back, Dr. Tan.
Thank you.
And I also have Professor Kim Moon-gyu from Yonsei University. Good to have you with us, Professor Kim.
Thank you very much.
Dr. Dan, there is much global concern over the spread of variants, including those from the UK, from South Africa, and of course from Brazil. How dangerous are these new strains of the coronavirus?
I can't overstate the potential risk posed by these new variants. So the UK variant is called the 2020-1201. Initially, it was thought that the biggest concern was increased transmissibility. So it's about 75% more transmissible. However, there's more evidence emerging that it is also causing more severe disease. There was a case report recently out of the UK in which a 78-year-old man was infected back in April with the then circulating wild-type strains of SARS-CoV-2. He got infected again in December with this new variant. The first infection was mild. He recovered, no problem. He was able to stay at home. The second infection was life-threatening. He really almost died because of infection with this variant strain. From this case study, a lot of things have emerged. One, as I mentioned, the possibility of more severe disease, but also there was evidence that this variant escapes some of the diagnostic assays that we use to try to detect COVID-19. Also, there's the chance of decreased effectiveness of convalescent plasma therapies, monoclonal antibody therapies. The patient, when he was infected the second time around, he still had good levels, high levels of antibodies from the first infection. So that also means that the risk of reinfection of all the people who have recovered from COVID-19 the first time around, the risk of reinfection with these mutant strains is definitely there. This new mutant from the UK is already in 60 countries around the world. The South African variant has been reported in 23 countries around the world, and all of the same concerns are there with the South African variant as well, in terms of less effectiveness of vaccines, more serious disease potentially, higher transmissibility, and escape from the therapeutics that we have currently in development. So, what do we need to do? I think it's a huge challenge. We need to up our surveillance, not just from imported cases, but we have to remember the UK variant is thought to have originated in a person who had prolonged shedding of the virus. She had been in the hospital for several weeks due to COVID-19. So we need to also survey our inpatients as well, domestically. We need to make sure we keep up with quarantine measures. We need to make sure that we have a good vaccine uptake once the vaccine is available next month. And then finally, we need to have second generation of vaccines in development so that we can deal with these new mutations going forward.
All right, there are a lot of tasks, of course, for authorities here. Professor Kim, Korea, for its part, has recorded at least 27 cases of these variants. What is your view on the danger posed by them here in the country?
First of all, we have to have a global aspect, and there is a key side, which means global initiative for sharing all influenza data. And they are gathering all the mutation information from all around the countries. And since last month, they report the reported cases are huge, and they call it variant under investigation. For UK, they reported more than 28,000 cases, and the second country is Denmark, which reported about 500. So huge difference. And USA is the third reported about 200 cases. And from Korea, we reported only 13. And interestingly, China reported only 2 cases. So I don't know why, but there's very few. There are 2 things we have to think. How are we going to block the foreign influx coming from other countries? And the second one is, how are we going to continue to control domestic cases? And if we found a new variant, how are we going to deal with that? So 2 is going to be important. Virus mutates, and there is a follow-up mutation information that says that this COVID-19 have about 1 or 2 mutations per month, and it's going to continue to mutate. And for Korea, since the virus loading is less than other country, that means we have a less possibility that we're going to have a new mutation from our own domestic origin. So that's the good news. But as I told you, we have to think globally, and we have to screen the travelers who's coming to Korea. And I wish that we have more vaccine research that we can monitor most of the cases come from foreign countries and react to those reports.
Right. Let's take a moment now to hear from Dr. Margaret Harris at the global health body, who has voiced concern over the rise in mortality amid the presence of these new variants.
At the moment, we're not seeing that it causes more severe disease, but if you've got something that's transmitting and infecting many more people, you will get many more people with the severe disease. So the reason we are making those kind of dire predictions is that we are seeing the number of deaths increase each week, especially because we've seen very large numbers of cases rising in particularly the Americas, North America and South America, but also in Europe. Now, in Europe, I've just been in a meeting looking at the numbers where there are a lot of variants transmitting. I mean, the same variant, but they're seeing large, considerable numbers of people with the variants. They have brought in very strict measures, and we are now beginning to see the numbers come down. So indeed, my Director General made an impassioned call for the world to understand that we need to be vaccinating in every country at the same time, and we need to vaccinate the high-risk target groups. Now, those are the doctors and nurses I was just talking about. We at WHO talk about health, but if you only care about money, if you only care about economics, it is an economic catastrophe for the world not to be vaccinating all around the world at the same time. So it's something we must all do.
Right now, Dr. Dunn, keeping in mind what Dr. Harris said earlier on in her interview, findings in recent days do indicate a subtle but tangible decline in cases over in Europe. Do you suppose the resurgence there has hit its peak?
Well, with the new mutations, I don't know that we can say that we're completely safe from a second round of the pandemic, not just in Europe, but throughout the world. Yes, European countries have implemented very stringent non-pharmaceutical interventions, but the question on the horizon remains, what will happen when these measures are eased? Also, we have the Olympics coming up. Are they going to be held? If so, in what way? Also, there's a huge recognition that the new variants are not being detected as much as they should be. There's under-ascertainment. In other words, they're probably much more spread out than we think, than we know. And so once these interventions are eased, I mean, we saw what happened after the summer, right, of 2020. There was a huge upswing in cases after the measures were eased. What will happen after this winter wave measures are eased? It's a huge question. Now, I think we could look to Israel for some perhaps advice or some hope as perhaps the best case scenario going forward. So they have also reported cases of the new variants, the UK variant and also the South African variant, not the Brazil variant yet. Despite this, they've had very good uptake of the vaccine so far. I think about 30% of their population has been vaccinated. And as a result of this very successful initial vaccination campaign, their new cases has gone down significantly. So I think we can really learn from this example, and I agree with what's been said that we really need to go full steam ahead with vaccination, and that will help. I don't know that that's necessarily the only, I know it's not the only answer, but it will definitely help.
Right. And staying with vaccines, Professor Kim, now Moderna claims its vaccine is effective against the UK variant, but less so against the strain from South Africa. Do you see this reality as perhaps affecting Korea's vaccine rollout plans? Because we are poised to receive about 20 million doses of Moderna's vaccines as well in the second quarter. What are your thoughts?
First of all, the major strain in Korea is not that of B117 of UK and not the B1351 of South Africa, so that's lucky. And well, first of all, Pfizer was very fast to report the effectiveness of their vaccine is working for the new strain. Moderna also made a similar report that they can induce antibody against the new strains, but the effectiveness might be declined somehow. So Moderna is planning to start a preclinical study or phase 1 study for that strain from South Africa. So they modify the mRNA a little bit to work against the new strain of South Africa. And I think it's not going to take a long time since they already finished the phase 3 study, and this is a kind of a minor change in their design. So we have time to wait for their results, hopefully. And well, as I told you, virus mutates, and nobody knows what kind of mutants might arise from another country, and still the pharmaceutical companies have an option to adjust against those events which might happen in the future. So still we need more monitoring about the new strains, and vaccination schedule or the drug modification might be possible.
Right. Dr. Dan, let's turn our attention now to the after effects of COVID-19. A British study shows 1 out of 3 discharged patients returning back to hospitals within 5 months for severe after effects. As a doctor yourself, what is your take on the lingering health problems of COVID-19?
Right, so this is an area of much ongoing research. This is a brand new disease and we're learning more about it every day. We do know that it affects many organ systems of the body, and we think that this is because of 2 things. First, the ACE2 receptor is the receptor that the virus latches onto to gain entry into our body cells. And this receptor is located in many organs throughout our body, including the heart, lungs, liver, kidneys, the brain and the blood vessels as well, the GI tract. And so the virus itself can infect many organs of the body. Secondly, the immune reaction, the inflammatory reaction to the virus that our body mounts. This can occur throughout our body, and we've seen this with other diseases, with other viruses, Epstein-Barr virus and a condition called Lyme disease, where you can have prolonged after effects after the acute initial infection with the pathogen. And so it remains to be seen just how long these effects will last, whether or not they can be cured, whether or not if we use anti-inflammatory agents early on, they can be prevented. I would say there are more questions than answers right now.
Right. And Professor Kim, local health experts too, for their part that is, have conducted their own study on the after effects of COVID-19. Do tell us a bit about their findings, including the most common health issues here.
We're already familiar with the new word called long COVID, COVID blue. It became a common word. Korean National Medical Center conducted a small-scale study, and 7 out of 40 COVID-19 patients showed a pulmonary fibrosis, and it happened about 6 months after the initial infection. And the further study is still going on. So that means not only for the lung, as Dr. Dan mentioned, many organs going to be involved. So we have to watch carefully and follow up the patients who even though recovered from the COVID-19. So if the patient shows a shortness of breathing or loss of hair or change of mood, better contact the physician, and well, every 3 months is recommended if you have some kind of trouble. In USA, NIH started to conduct a huge study, including more than 37 medical centers, and the patients going to be more than 50,000, and it's called cohorts for COVID-19 research study. And then they're going to follow up all the cases for any kind of problems. And I think Korea is also going to need that kind of study initiated by the government, and that we should have the data of our own.
Right. Hopefully in the near future.
Yep.
Meanwhile, a study by experts at Edinburgh University shows COVID-19 leading to abnormalities in heart functions among hospitalized patients. I have Professor Mark de Wek live on the line with details on that. Welcome, Professor de Wek.
Good morning. Thank you for having me.
Thank you for being with us, Professor. Do start by telling us about the findings of your study.
Yeah, so we conducted a global registry. This involved more than 1,200 patients from 69 countries all around the world. And essentially, we wanted to know what the echo findings were of patients who were having a heart scan who had COVID-19 and were in hospital. And so we collected this data over a short period during the first wave of the pandemic. And we found that around half of the scans were abnormal. There was some form of cardiac abnormality on about half the scans. And about 1 in 7 scans, there was a severe abnormality likely to have a major impact on the patient's disease course. So this was, I guess, one of the first insights about how prevalent heart involvement is in COVID-19 in this selective group of patients that were sick and having an echo scan in hospital.
Professor, is there a common factor that appears to make a COVID-19 patient more vulnerable to such cardiovascular impairment? And is this heart damage reversible?
Yeah, so those are great questions. I mean, the first question, as I said, we saw this in sick patients. These are people that were already in hospital with heart disease. So we've not studied it in detail in patients that are not in hospital. I suspect the rates of heart involvement will be lower in the more general population. So, one major factor is severe disease. The second factor in our study was if patients had elevated cardiac injury on blood tests. So we've got blood tests that can pick up this injury, and this seems like a pretty good way of screening out the patients that need an echo scan to have further assessment. So your second question about reversibility is extremely important, and our study wasn't able to capture that data, and that remains a slightly open-ended question. There is some data in the literature. It's a bit conflicting, it's controversial. What I can say is that there are studies ongoing that will really answer this question. But our experience is that we're not seeing a great influx of patients coming to our clinic with heart failure or severe problems with their heart in the aftermath of their initial infection. We are seeing patients who present with palpitations, feeling of their heart racing in quite a benign way that we can control quite effectively with tablets. So we need more work in that area, but at the moment it doesn't look like there's going to be a huge wave of patients with severe heart problems long after their COVID-19 infection.
I see. All right, Professor de Wek, thank you very much for making the time to join us at this very early hour at your end with your thoughts.
My pleasure, thank you.
Right then, Dr. Dan, I suppose it depends on the severity of the symptoms, but do you suppose the after effects of COVID-19 can be fully treated?
I think we can utilize a comprehensive approach and think about this as a long-term condition, and also get multiple departments involved, including rehabilitation, including perhaps psychiatry as well. The goal, of course, is to help people who have recovered from the acute phase of COVID-19, help them become fully functional again. And it remains to be seen. As I said, it's an ongoing process, whether or not there will be permanent disability, how much of the disability we will be able to help the patient recover. And but one thing that is clear is that we can't think of this as just a lung disease or just a heart disease, as the professor said from the UK, that we have to think of this comprehensively.
For those who have lost their hair, is that reversible? Do they have their hair growing back? Do we know?
I'm not sure about that.
Which is why you said there are more questions than answers right now.
Right.
Professor Kim, Chinese researchers meanwhile claim the virus may lurk deep inside the lungs of patients undetected by conventional testing methods long after they've been discharged from the hospital. What are the implications of this finding?
was very difficult to find the clue of this question. Still possible maybe, but I'm more concerned about reinfection and recurrence for COVID-19. Still rare, but it's concerning, as Dr. Dan mentioned in the beginning of this program. PCR may be positive even though there's no replication competent virus. I mean, there are many patients who, they are already free of COVID-19. They have no symptoms, but still the test is positive. But that does not necessarily mean that he can transmit the infection to another person, because PCR is very sensitive. Even though you have a small portion of that RNA, virus RNA, you might show positive for PCR. So we have to verify the China report, but it might be a special situation, such as the patient might have underlying disorder or patient might be immune compromised. But still, we don't know the whole picture of COVID-19 yet, so we'll see. But since I tried to find out all the articles reported about this situation, it was very difficult to find a similar one. So the reminder that I want to say is COVID-19 is highly infectious for the first 5 days of infection, and it lasts until the 9th day. After that, the virus or the virus particle might show up from the mucosa until 17 days. So it might be not infectious, but still you might show positive. Korea has a very strict quarantine measures, and if you are positive for PCR, then you still have to quarantine yourself. So our policy is very strict, and it's good to deal with some variations that might have prolonged the leakage of virus particles, which might infect other person. But the final word that I want to say, still you can have a positive PCR result with only a small particle of the virus, which is not infectious.
I see. Meanwhile, Dr. Dan, we also recently recorded human-to-cat transmission here in the country. What are the chances now, then, of a cat-to-human transmission?
So there are 3 things that I want to mention. First of all, COVID-19 is a zoonotic disease. In other words, this whole pandemic started because the SARS-CoV-2 virus was transmitted from an animal to a human. So that's the first thing to keep in mind. The second piece of information is researchers looked into the outbreak of COVID-19 in mink in Denmark. And what they found was the infection went 2 ways, both ways. So it went from humans to mink, and then there's evidence that it went from mink back to humans. They did the genetic studies to prove this. When they looked at the epidemiological data, 68% of all of the employees, their family, their contacts, of people who worked at the mink farms had evidence of SARS-CoV-2 infection, okay? So we know this is how it started. It's happening in mink. We do not have any evidence of the infection going from pets to humans yet. But COVID-19 has surprised us at every turn. And so I think this is an area that needs more research, but we do need to be careful.
Right, I suppose it's better being safe than sorry then. Professor Kim, given Korea's current COVID-19 status, what do you believe are some of the greatest variables in our ongoing fight against the pandemic?
We have to add the knowledge about COVID-19 since we learned from the last 1 year. At the beginning, we knew nothing about COVID-19, but now we have pretty information about it. But still, we have a new variants, mutations. We have to be cautious, and more information are just pouring out from everywhere. So our government and the experts should be updated about this, all these informations. And when the health authorities make their policy making, it should be applied on the new policy making. And it was not successful, and even in USA or in UK, I mean, they didn't have a very good scientifically applied policy making at the beginning of this outbreak. And well, it's very difficult. I would recommend two countries which started very good at the beginning. The one is Taiwan and the other one is Sweden. Right now, I think Taiwan is one of the best countries to deal with COVID-19, and they're still doing very good. And Sweden had a good, didn't have a good start, but after a few months, their mortality declined, and many North European countries studied how they make it out. But since we have a new mutation, I don't think they are in a good situation right now. So all of this is about the policy, and if the experts are in charge of making that quarantine policy, at least we have a principle and we have a rationale, and we can adjust to the next thing happening scientifically. So when we have to decide which vaccine is better, the scientific principle should be applied, and who's going to be the first one? Who's going to have the priority to get vaccination? It should be scientifically applied. And as I mentioned at the beginning, there is this study about the new mutations, and from Korea we reported only 13 cases of variants, which is very low, and that means our research power is not that strong enough to this pandemic. So I wish that the government will empower our research facilities. And it's a very difficult situation to deal with. I mean, government has its own issues about the economics and education and everything. And experts know about the virus very well. And we need a good communication to have the best policy for South Korea. And I hope that this communication continues and even develop better so we can deal with the rest of the pandemic.
We hope so too. Dr. Tan, do you see the launch of vaccines here in the country next month as easing our current hardships?
Well, I think the launch of the vaccination campaign, if it is successful, will signal the end of the beginning. Experts have said that in order to have enough production of vaccine, we may need to wait until 2023 or 2024 to see the kind of global herd immunity that we need to say, okay, we have a good control of the pandemic on a global scale, global herd immunity. So we need to be mindful of the timeline. The second is, vaccination is only one component of a comprehensive package that needs to be sustained at least through 2021. And of course, we're all familiar with what we need to do: mask up, distance, practice good hygiene, disinfect, and also ventilate our indoor surfaces. That cannot go down. Those measures cannot be eased. That needs to be continued. Otherwise, we risk another fourth wave on top of this third wave. We just don't want to go there. So yes, vaccination will help, especially if we can get everyone above the age of 50 vaccinated and immune to COVID-19. I think that will be a big game changer in terms of the significance of the disease on our society.
All right, Dr. Dan, as always, thank you very much for your thoughts. And Professor Kim, thank you for being with us today.
Thank you very much.
Right, and adding on to what Dr. Dan has said about our safety measures, do seek to get yourself tested should you believe you may have been exposed to the virus or if you have symptoms similar to those of the seasonal flu or the common cold. Thank you for watching. See you tomorrow.